Well, it's not unusual to have heartburn or indigestion from time to time. We've all been there. But if the symptoms are frequent or if they're severe, you might have a more serious condition known as gastroesophageal reflux disease. This is sometimes referred to as GERD or acid reflux. Reflux occurs when stomach contents wash up into the esophagus and back up into tissue that's not prepared to handle the acid. And this produces damage to the esophagus lining. In some cases, it can produce precancer type cells that form a condition called Barrett's esophagus. Barrett's esophagus is important because it makes you at much higher risk for cancer of the esophagus. Esophageal cancer is one of the more deadly forms of cancer, and it's definitely on the increase in the United States. You're much more likely to get Barrett's esophagus if gastroesophageal reflux is untreated for a long period of time. So it's important to recognize the symptoms. The common symptoms of reflux are heartburn, a burning pain in your chest, back of your throat, sometimes trouble swallowing, regurgitation of stomach contents, a cough that is non-productive and won't go away, constant sore throat, frequent belching and burping. These are all signs of reflux, and they warrant seeing your doctor and having something done about them. When you see your doctor, a test that's commonly ordered to evaluate reflux disease is an EGD. This is a test where a flexible scope with a small camera is gently passed down the throat and into the esophagus after you've been sedated. The EGD will show us if there's inflammation of the esophagus, and if a biopsy shows that Barrett's esophagus is present, that requires monitoring. Every 1 to 3 years you'll need to be checked again depending on the degree of inflammation. If biopsies demonstrate dysplasia, which is damaged tissue to the point where cancer is imminent, radiofrequency ablation can remove that damaged tissue and it grows back as normal, and surgery is no longer required. Currently, we're the only group in town doing this procedure, and is one reason that you want to be quick to let us know if you're having the symptoms. And if you contact us at 534-7330, we'll be glad to evaluate you and tell you if this is required.